Welcome and thank you for joining me for a skin treatment. I'm going to show you how to prepare for a facial and how your treatment journey is supposed to be going, and also how to communicate to your client throughout the treatment as well as the finishing touches before they go. All ready for your facial, you need to make sure that you have all your products that you're going to need for the facial and as well as your tools. So you can choose one or two items of the three that you are going to use in your facial. For example, everybody is going to have your ice pack for your eyes that needs to be kept in the fridge. You're also going to have your ice globes or a gua sha, whether it's the round stone or a facial massager like that. So any type of gua sha that you have in your clinic. And make sure that you have a facial brush, a spatula to scoop out your products from your container, your sanitizer to sanitize your spatula before you use it, and then also if you are going to do a deep cleanse facial, that you have your steamer ready and that it is cleaned and also filled with the distilled water, your mag lamp that you are going to need for extractions, or if you want to just do a nice thorough skin analysis to look through the magnification lamp and also make use of the extra light for your skin analysis. So whether your client's coming for the first time or a returning client, if it is a brand new client, you do want to go through the flip chart. So book extra time for that full consultation, because you do want to find out what is the expectation of the treatments they do want, and also explaining that treatment journey to them, that it's not just a once-off treatment to achieve results, but you are going to need 3, 6, 9 or 12 treatments depending on the concern and what results we want to achieve, and that you can explain that specific concern in this consultation with the skin flip chart as well. You want to manage the expectation from the beginning they start with us and also throughout their treatment journey. So when you've done your cleanse and your eye makeup removal, you are going to do a full skin analysis every time your client comes, not just in the first treatment. So you can close their eyes like this with the tissue paper, fold the tissue paper, wet their temple area. The wetness on their skin will just stick the tissue to their temple area, and then you can bring your mag lamp closer that you are going to then use for the skin analysis. So look through the mag lamp. So you would normally start on the forehead, work your way down to the chin, the neck, and also to the décolleté area. So you want to touch the skin, pinch it to see, like, is there any dehydration lines and how deep are they. You want to touch the skin in sense of texture. So is it rough skin texture due to congestion? Is it due to dehydration or dryness? Also have a look at the pores to see if there's any congestion, enlarged pores, the cheek area, any sensitivity, redness, and is it sensitive in the sense of they have sensitive skin, or is it sensitized due to an impaired barrier? You also want to lift and pinch their cheek area to see the elasticity and firmness. Look at their lip area as well. Is there any lines and wrinkles around their lip area, any congestion, chin area? There you can also see if they do struggle with any hairs on the chin. Is it a concern for them? Do they want to treat it with laser or with electrolysis? And then you're going to go down the neck area to see, is there any pigmentation, obviously over the face as well, but going down to the neck and the décolleté as well, and how do they want to treat their skin. So with your skin analysis, you want to chat to them about their skincare as well. What are they using at home? What do they want to do in between treatments? Meaning, do they want to come for a treatment every second week to target their concern? Are they willing to come once a month? What is their time availability and budget? And also give them a treatment plan. So normally start with 6 months treatment plan, and you break it down into 3 months if they can't start with 6 months straight away. So we do have the special or packages available that they can purchase to make it worth their while. But you do want them to commit in the next few months, because this is, yes, the intent immediate result after their first facial, but also the more often they come and with good skincare products, they are going to get results much better and faster as well, and also more long term. Right, so depending on the facial that you did, you're going to apply the mask first on the facial area, and then you're going to apply the cold eye patch. So with the tissue first on the eye area, and then with the eye patch on top. This can then stay on for the 10-15 minutes, however long your mask is going to be on. While the mask is on, you do want to offer them a head massage, a neck and shoulder massage, or a hand massage. They can choose which one they would like, and offer them to them all the time, so if they want something different for that day, that they will be able to tell you. So before you use the ice globes, you do want to sanitize them with the client so that they know that they get sanitized on a regular basis, and before you're going to apply this to their skin. In a treatment like a microneedling or a dermaplaning, a peel treatment, you can actually do those in a circle motion over their skin after you've done that treatment, just to cool and soothe that skin. Or you can do it in a deep cleanse facial when you do a facial massage, to make it part of your facial massage movements. In that same facial, you can also make use of the gua sha. So you can choose one or two tools for that facial, as I said earlier. Either do your stone gua sha, support the skin, and then you're going to focus on lifting and firming the skin while you treat it. So having your vitamin mix oil on the skin just for some slip, or a deep cleanse facial for example, or after a peel just to also soothe that area as well. Or if you have the stone, you do want to support the skin and also just roll it or do some draining movements with the stone on the face as well. So you're going to take your lemongrass aromatherapy oils. You're going to just put a few drops on your fingers before you start your facial. So make sure that your client's nice and comfortable, they're warm enough. If you had to heat up a warm bottle for them to hold onto just to be comfortable, that's perfect. Then you're going to ask them to take a nice deep breath in, hold it for a few seconds and breathe out, and you're going to repeat that 3 times. Okay, Andrea, I'm going to ask you to take a deep breath in and out, and in and out, and in and out. And you can just put some pressure on their shoulders before you start that facial to help them relax throughout. Once you've done your skin analysis and before you continue with the facial, you do want to ask your clients if they mind taking a before picture. So either on their own phone, or you can take it with the work phone and load it onto their Zanotti profile. On the indemnity form, they can also tick if they allow us to take photos. It really just helps to see the progress of this entire journey, on what their skin looked like before we started, how does it look like during the journey, and what does it look like towards the end. So you do want to take a picture in their first treatment, and maybe about 3 months later, and then 6 months later, to see the progress throughout that journey. Then for your treatment, you do want to give them a bit of an outline of the facial. So in the beginning, you can maybe mention the full sequence, in the sense of, we're going to start cleansing your skin, I'm going to do a full skin analysis to have a look at the skin, then I'm going to continue with the actual peel, to do a chemical peel on the skin. You might experience the following examples: some tingling, some itching, it might subside quickly, or it can prolong a little bit longer depending on what treatment you're doing. You're then going to do a facial mask using the tools either in the mask or after the mask. Then you're going to remove the mask, apply a moisturizer with some biolipids to help with extra nourishment, hydration, and repair the barrier, and if it's appropriate, then the SPF to finish the treatment off. After your treatment, you do want to ask them, how did they find that treatment? So was it enjoyable? Was it what they expected? Is there anything that they would like to be done differently in next time? Just to get that immediate feedback, whether it's good or bad, that you can address it in the moment. And also bring their home care recommendation into the room as well, if you like, or if it's appropriate for that specific client, to show them in the reception area what home care products you recommend for them to use. So either they start with TLB Scientific Skincare, or add on a few products into the existing skincare regime, displayed at the front desk once they decide what they're going to take home. Make their next booking before they make the payment. So book their next appointment and then take their payment for that day. After a day or two, definitely give them a call or send them a WhatsApp to follow up after their last appointment, just to see how their skin is feeling. For example, if they are doing a treatment that the skin could be flaking, has that started yet? Or is the skin feeling sensitive, or actually is it feeling perfectly fine? And what they can then just expect in the next 7 days in the healing process after the facial that they've done. Thank you for joining me today, and I hope you understand the treatment journey for a facial, and also manage your clients' expectation, helping to achieve their goals, seeing great results with your treatment plan. I hope to see you next time.